This Week in Richmond is made possible in part by Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. KANAWHA Valley Arena, Virginia's cowboy town, hosts Civil War reenactments, ATV rodeos, mud bogs, diesel truck pulls, and high school rodeo finals. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and on this particular show, this segment and the one that's following, we're going to have the four docs, the four doctors who are members of the General Assembly. We have two members of the House, Dr. Scott Garrett, delegate, and Dr. Chris Stolle, delegate, and you'll be followed by two of your colleagues later in the show. But we're interested in having you inform the viewers about whether they're medical issues or other issues that you all are seeing as very important issues in this session. And you're welcome just to converse with each other, and I'll keep track of the time.
Well, David, it's great to be with you and your listeners. Dr. Stolle and I both serve on the Health, Welfare, and Institutions Committee, and we've been moving right along with our legislative efforts. We haven't had a lot of controversy this year, which has, I think, been a welcome respite from some of the issues in the past. This year, I think the General Assembly is very much focused on the two major key initiatives that our governor has put forward, those being transportation and specifically adequate funding, preserving long-term resources, and then I think K-12 education efforts as well. We just haven't seen a whole lot in the health arena that for us to get all worked up about, but we've certainly got plenty of moving parts and a lot of discussions.
Yeah, I would say I would agree with Scott. The main emphasis this year, of course, has been transportation and K through 12 education. Jobs, economy, always at the forefront of what we're doing. But I would say there is absolutely this discussion that's going on a little bit in the background about what we're going to do with Medicaid extension or expansion, whatever terminology you want to use with that, and how we can take and best prepare to make the most of that program. And I think that right now the general perception is that we probably should not expand Medicaid without some really dramatic reforms coming forward, some flexibility provided by the federal government. Pretty much as it stands right now, the Medicaid program is dictatorial, maybe a little bit too strong a term, but certainly driven top-down from the federal government. We'd certainly like to see that more of a partnership. I think we in Virginia know how best to treat Virginians, and a one-size-fits-all probably is not the best way to move forward.
Am I correct in thinking that issue hasn't been so much debated before your health committee? Is it more in the appropriations committee or other places, or have you been dealing with that some?
Well, David, it's really more in Washington, frankly, and that's the challenge we have. And I think what we're seeing at the state level and with legislators is tremendous uncertainty, and we simply don't have guidance from Washington. The governor and his policy folks have for months been trying to get answers to key questions that we need to try to come up with what is prudent public policy in this arena, and we simply, it's still unsettled. We simply don't have those answers yet.
I don't want to steal Dr. O'Bannon because he's coming on next section, but I believe Dr. O'Bannon has taken and putting in a language amendment to the budget, so there's no cash associated with it, but a language amendment that would at least start setting some of the parameters of that flexibility that we would need to have for the Medicaid program in order to move forward.
On the other matter that was discussed, I think it must be settled, and that's the health exchange. Has that issue been kind of settled for now as far as whether it would be a state exchange or tapping into the federal one?
Well, I think it's settled in the sense that we do not have a specific plan to create a state-run
Yes.
health insurance exchange today. However, there are still ongoing conversations and discussions between folks and policy leaders in Washington and our policy folks here in Richmond, the governor's team, to try to better understand the process and to come up with the best working plan for all Virginians in that regard.
I'd say Scott's absolutely right on that. Even though that we have opted out of running our own state plan, let the feds run that option for us, there still has to be cooperation between the state and local, state government and federal government. The insurance companies are still licensed in the state of Virginia. They still function within the state of Virginia. So there has to be that cooperation, but definitely we'll let the feds take that on, at least right now.
You know, it certainly is a big challenge because although a law has been passed and certain parts of it upheld by the Supreme Court, all kinds of regulations that have to come follow that just leave a great deal of uncertainty.
Well, and David, to your point, the Affordable Health Care Act is a bill, a law that is passed, but it flies in the face of everything that we here in Richmond in the state government level hold near and dear. We have two key elements to our legislative process. One, the Commonwealth of Virginia, the General Assembly is by constitutional dictate required to have a balanced budget.
Yes.
The second is we have, as you know, a single object rule. Every bill, every legislation that we introduced can only affect a single object. The Affordable Health Care Act, so-called Obamacare, has thousands of multiple independent objects within it. And I think herein, frankly, is the problem. The folks, my folks back home, they simply don't understand the extent of it, the gravity of some of these, the implications of some of these issues, the law of unintended consequences, and trying to better understand it and come to grips with what, at the end of the day, hopefully we will end up with an even better healthcare system. But there simply are so many questions yet to answer. And unfortunately, it has a January 1 of next year, 2014, that we've got to have all those answers by. So we've got some challenges.
What about some other issues beyond medical ones, other bills that perhaps you all are carrying or bills that your colleagues are carrying that you see as some key bills? Of course, you mentioned the two big areas of transportation and education.
Well, certainly transportation for Hampton Roads is just extremely important. And so certainly the governor's bill is out there. Hampton Roads has also introduced a bill that I'm carrying that is a regional solution. It's complementary to the governor's bill. If for some reason we did not end up with a statewide solution, there would still be a regional solution for Hampton Roads. That bill is still in Finance Committee. So we'll probably see here in the next day or two what the outcome of, whether that'll move forward or whether that will be laid on the table for another day. But I think that from Hampton Roads' perspective, transportation is just an absolute pivotal issue. We talk about jobs and economy, but our jobs and economy is tied to a adequate infrastructure, and we don't have that right now. We know that the Panamax ships are coming 2014, 2015. We're the one port on the East Coast that can handle those ships, and we're struggling with our infrastructure that we just have to get that under control. Military said they're not bringing another person to Hampton Roads until we get our transportation solution fixed. These are huge economic drivers, not just for Hampton Roads, but for the entire state. And this is something we just have to address this year.
And Dr. Stolle, being an OBGYN in the Virginia Beach area, this is near and dear to his heart. He has lots of folks that this impacts directly. As a general surgeon in Lynchburg, 4 hours inland, it's not quite the concerns that we have. Some of the legislation that I'm carrying specific to healthcare, as you know, I introduced legislation 2 years ago to get the K2 and spice, these really very dangerous bioorganic chemicals, synthetic marijuana they were referred to, off the streets. We have legislation this year to continue to try to stay a step ahead of the organic chemists. I have legislation that, in fact, I'll be arguing today to add a particular chemical, ammonium nitrate, which are in these cold packs that you get. You shake them and they get cold. That is now the #1 chemical used to make methamphetamine in the mixture with this that these cooks that are cooking methamphetamine is using. So we're adding that chemical to the list to try to help keep this away from our young people. I have legislation I'm excited about. It's very important, particularly to my neck of the woods. It's a legislation to create the Virginia Nuclear Energy Authority and the Virginia Nuclear Energy Consortium. For the last year and a half, Virginia's nuclear power folks, nuclear energy folks, both in the private sector as well as higher education, our professors, educators, researchers have been trying to create a platform by which they can better collaborate with research and development and utilize their intellectual property. We've got folks that can do the research, but they may not necessarily have the marketing piece or may not have a research lab or some of the academic assets and experts. And this collaborative is really, I'm very excited about. I think it'll be a great opportunity for our Commonwealth to continue to move forward and to continue to assure folks that we are the nation's leader in power in Virginia.
Very good. I think the Lynchburg area has been known for that in some of the past too, that there was a major corporation there that's done a great deal of work in nuclear energy.
We have two corporations there, David, Areva and Babcock & Wilcox. They're nuclear service, they're in the nuclear service industry, and they service a large percentage of the nation's 104 power reactors right here in Central Virginia.
So has the uranium issue bubbled up as far as the medical perspectives, or is that more of a regional perspective? I mean, many of the folks down your part of the state have some concerns. I'm not sure about in the Central Virginia, but that certainly is one of the issues that has been a hot issue in the session.
I think that's, we'll be addressing it before the session's over in one form or another. I think the bill was dropped not last Friday, but the Friday before last, if I remember correctly. And so I think that as it works its way through, we'll see that. Certainly Hampton Roads, there are great concerns in Hampton Roads as to the security of the water supply. We get 60 million gallons a day from Lake Gaston, which could theoretically be at risk. And that just doesn't go to Virginia Beach, but that goes throughout Hampton Roads. And some, even the threat of contamination is enough that it may have an impact on tourism, which is a significant industry for the entire state.
And this issue, David, at the end of the day, I think will center around whether mining and milling of uranium in the Commonwealth can be done safely. There are folks that believe that it is inherently unsafe, and they simply oppose any legislative effort to allow any progress forward. But I think ever increasingly we're getting information back from the Nuclear Regulatory Commission, back from policy experts and the National Science Academy, their studies, Virginia Tech experts that are beginning to make the story and make the case, I think, that this can be done safely. The current governor's policy is about 125 pages of what we would need to put in place as far as regulations to assure all Virginians that this can be done safely. I think at the end of the day, that's really where this issue is going to come down for many folks.
Well, it's been an issue that's been around for a while and sort of back in force this year with the studies that have been done.
Surely.
Really appreciate the two of you starting off this show with the four doctors, and look forward to having you back on to talk about some issues because we're weekly throughout the year. So I want to thank you both very much for being on This Week in Richmond.
My pleasure.
David, thank you, and for your work and reaching out to all of our listeners as well.
Thank you.
Thank you.
As we continue with This Week in Richmond, delighted to have the other two doctors in the General Assembly, Dr. John O'Bannon, Dr. Ralph Northam. Thank you both for being on This Week in Richmond. And we'd love to have you talk with our viewers about medical issues and about other issues in the time that we have, some important issues that you see coming up in this almost now the second half of the session. John, why don't you start, and then Ralph, and then you all are welcome to ignore me, and I'll just watch the time.
There you go.
Well, David, it's fascinating to me. I've been down here now about 11 years, and it is impressive that we have 8 million Virginians. We have 100 members of the House, 40 state senators, and the process here is based on diversity. And so I think we're very lucky to have Senator Northam in the Senate. We've got 3 members in the House of Delegates that are physicians with medical background. We got a nurse, we got physical therapists, got a couple of pharmacists. So we are lucky to have that level of diversity. It has been an interesting experience. We have worked on health-related things together. Ralph is a child neurologist, so he's a real expert on concussions. A few years ago, we worked on some childhood obesity initiatives, and I was pleased to see that the Senate might be doing something on that this year.
Right.
Ralph?
I would just reiterate what Delegate O'Bannon said, to have 2 doctors. Of course, we have 4 total, but it's interesting that we have an adult neurologist and a child neurologist.
Yes.
So we have all the territory covered. And, that with 4 of us up here, as Delegate O'Bannon said, there are 140 legislators, but there are a lot of health care related issues. They're complicated. There's a lot of uncertainty as to what's going on in Washington. So it's just great to have 4 physicians here to hopefully put Virginia in the best possible posture so that we can provide quality health care to all Virginians.
It's amazing with the citizen legislature, part-time legislature, that 3 of the 4 of you are still very active in your practice. One, perhaps, who was on the earlier segment, somewhat retired, but so you're juggling practicing medicine in your own areas as well as serving here at the General Assembly.
Well, I could speak to that very quickly, and we have to give credit to our partners, and I know John would agree with me, starting with our home partners, our wives. They're certainly very supportive, but personally I have 4 partners, medical partners in my office, and I couldn't be up here for 2 months without their support and their kindness.
David, I think we would agree we're living the dream. We're doing exactly what the citizens, I think, want us to do.
Yes.
Which is to honor the part-time citizen legislature model, which I think is a healthy model. Citizens of Virginia have been very smart. We're going to be gone February 23rd. This is a short session, and we're all going back home. We're all going back to our jobs, wherever they may be.
Right.
So we're really not full-time politicians. Public wants people to be there when they want them. They want them working full-time, but they don't want them doing politics all year long.
Right. What about then some of the medical issues? Are there medical issues before we look at others that you all would want to mention to our viewers?
Well, just a couple. I'm sorry to jump in.
No.
Just a couple very briefly that I'll tell you about that we've been working on. As John said, we've done a lot of work in the past with concussions to protecting our student athletes. And so what we're doing this year, and I'm not sure we'll get to the bottom line, but the current legislation takes care of those that are going to the school. We'd like to expand that just a bit so that the rec leagues that are using school property, they're using the same guidelines, merely as an educational tool. That's what we're trying to do, is to educate student athletes, their families, and coaches. So we're working on that. That's kind of working its way through the General Assembly. The other issue, just very briefly, that I'm working on, which is going to be a little bit controversial, is smoking in cars. I've worked on some legislation in the past, the smoking ban in restaurants. We know that secondhand smoke is dangerous. So what we'd like to do is make it unlawful for adults to smoke in cars when there are children in the car. We know that there's an increased incidence of asthma, bronchitis, ear infections, even SIDS, sudden infant death syndrome. So that's what we're working on now. Where the line is drawn is how much government do we want in our lives? In other words, should the government be telling people what they can and can't do in their car? So a good discussion, and we're having that. And I'm not sure that bill has been successful in the Senate so far, but it has a long journey ahead of it. We did it a few years ago, and it didn't pass. But anyway, we want to do what's in the best interest of our kids.
And Ralph brings up a really good point that I think is worth making to your viewers, and that is this process is teed up to be hard to get a bill passed. Mm-hmm. It's got to be introduced, it's got to pass a committee, oftentimes a subcommittee, and then the full floor of whichever body you're in, and then over to the other side for the same process, and eventually to the governor to sign. And we got bushwhacked a couple of years ago on a bill for childhood obesity, where we wanted all the elementary schools to do 30 minutes of physical activity. Unfortunately, the governor didn't see that way. He thought it was a mandate. But point is that it's a hard process to get something passed. I can tell you something that I think is really important. It's actually as a result of this terrible school shooting up in Connecticut. So we're now, and I commend the governor for this, he's got a big task force together to look at education, to look at mental health, to see what we need to be doing differently in the mental health arena to protect our citizens. We learned a lot from Virginia Tech. We had a big commission after Virginia Tech. Professor Bonnie up at UVA helped us with that. We studied that whole process whereby somebody with a mental illness problem interacts with the green warrant system or the system where they get into either police custody or the healthcare system. And we changed those rules for the better. But we've got a lot we could do in that whole mental health arena.
Other issues, Senator Northam?
Well, a couple other issues that we're again discussing and always open to the public's opinion. One is the uranium issue, and that's certainly on our radar screen this year. You know, as a physician, and particularly from Hampton Roads, I have some concerns about the health implications of uranium. Also, we have to protect our drinking water, so that's certainly something that is on the minds of a lot of legislators. It's being discussed. You know, another issue is our Medicaid. Medicaid is a tremendously large portion of our expenditures here. The costs are getting out of hand. We're trying to figure out how to deal with that to slow the train down a little bit, if you will. One of the issues on the table is the Medicaid expansion that we continue to discuss. What, you know, the pros and cons. Is that the best thing for the Commonwealth? So those are some things that we're working through.
Yeah, I would agree with Ralph. I think there are two major things that are the result of the Affordable Care Act or Obamacare that the states across the country each have had to deal with. One is what's called the insurance exchange, and that's the process whereby the folks, and I don't want to do inside baseball here, but they're categories or levels of folks whose income determines where they'll be eligible. And the insurance exchanges are set up to help people get private insurance policies through any one of a number of companies that are selling insurance. And something like 16 or 18 states have chosen to go ahead and run those on their own. Perhaps as many or more states have sort of taken a wait and see that where they're going to go ahead and let the federal government do that or enter into some sort of hybrid where the federal government might start it. I know that Maryland, I think, invested somewhere in the range of $500 million budgeted to run one of those. So they're not really necessarily inexpensive things to do. So I think we've decided as a state likely we're going to go ahead and tiptoe. We'll let the federal government start it since they're substantially making all the rules anyway. I think the Medicaid, as a provider, anything we can do to get poor people more health coverage is laudable. It's the right place for us to be. The problem is things don't happen in a vacuum. So we really got to be aware of, you know, the current Medicaid program is the fastest expanding part of our state budget. Mm-hmm. And you've got the issue that healthcare things are generally more important than other parts of the economy. That's the cost curve in healthcare that you hear so much about. So we're really looking at threading the needle here, finding some way where we can make the Medicaid more efficient, maybe reform it. We got so many folks that the small proportion of the people use up a lot of the resources, the dual eligibles, the chronically ill people. So if we can get some flexibility from Washington, it's a good negotiation, if you will, where, and some states have done this. Some states, they call them waivers. It's inside baseball, but it's the way where you can sort of make a deal to get more control, and then you can do maybe a better job of managing your own people.
Yeah, one of the things when we look at healthcare that, you know, the system really, if you look at the big picture, is evolving from one of what we call a quantity-based system. In other words, how many patients we see in one day, how many tests we do, to more of an outcome or quality-based. And that's, as far as addressing the cost issue, that's the direction I think that medicine is going in. And I would just reiterate, it's nice to have citizen legislators up here. Again, we have 4 physicians, so it's important that we're here at the table when those discussions are occurring.
Well, certainly the two of you and your 2 colleagues add a great deal, and even a healthcare caucus that includes people from other areas in healthcare. So Virginia residents are well served. People need to see the doctor when there's a need for the doctor, and we can tell them that there are 4 doctors in the General Assembly. And really appreciate your being on This Week in Richmond and informing our viewers on these issues, and look forward to having conversations with you even after the session to see how things are going. So thank you.
Yes, sir. Thank you.
This Week in Richmond is made possible in part by Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosts Civil War reenactments, ATV rodeos, mud bogs, diesel truck pulls, and high school rodeo finals. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.